This is Dr.RED Panda.
Greetings, human friends. It's Dr.RED Panda. Cannibalism has been a part of human history for centuries, and it's often depicted in myths and legends. In Greek mythology, Cronus, the king of the Titans, had a habit of eating his own children. When Rhea, Cronus's wife, gave birth to their son Zeus, she knew that Cronus would eat him too. So she wrapped a stone in a blanket and presented it to Cronus as their newborn child. Cronus, fooled by Rhea's deception, swallowed the stone whole. In reality, except for some extreme cases, only in the natural world can we find animals that cannibalize each other for survival, such as tadpoles and mantises. An example of cannibalism among peers is the 1972 Andes plane crash. In 1972, a gripping tale of survival unfolded in the Andes Mountains when a plane carrying 45 members of the Uruguayan rugby team, including players, friends, and family, crashed after encountering an avalanche. This once united group faced a tragic turn of events in the harsh wilderness, with 8 individuals tragically losing their lives while the survivors found themselves in a desperate situation. In the frigid mountains, they had only a limited supply of food and supplies, including some wine and chocolate. In order to survive, they were forced to take drastic measures, including eating the bodies of the deceased. The harsh climate and challenging conditions kept them in the mountains for 2 long months. They then sent out a few members to search for help. After a 10-day trek, their persistence and determination finally caught the attention of a Chilean shepherd who became their saving grace. The shepherd led the rescue team to the survivors, ending their ordeal. The question is, besides the moral implications, are there any other more terrifying reasons why humans can't eat each other? In 2019, the Centers for Disease Control and Prevention, CDC, in the United States issued a bulletin warning of a contagious disease called zombie deer that was spreading among deer herds in the United States and Canada. The disease causes deer to become disoriented, lose weight, become uncoordinated, drool, and become aggressive. It is 100% fatal. Scientists who have autopsied infected deer have found that their brains are significantly shrunken and riddled with holes. However, this is not the first case of the disease. As early as 1967, some deer in northern Colorado began to exhibit symptoms similar to those of zombies. Because infected deer initially showed weight loss and lethargy, they were called chronic wasting disease, CWD, at the time. The disease eventually led to the death of infected deer. This symptom was not officially confirmed until 1978. It is a type of transmissible spongiform encephalopathy, or TC. The most well-known TSC is mad cow disease, which once broke out in the UK. Mad cow disease, which has had a devastating impact on humanity. On October 25, 1986, the first case of bovine spongiform encephalopathy, BSE, also known as mad cow disease, was discovered in a black and white dairy cow in the town of Axminster in southeastern England. The cow initially became listless, then unsteady on its feet, and eventually foamed at the mouth and collapsed. The disease gradually spread throughout the world, posing a major threat to the cattle industry, the food industry, and even human life. According to the records, the outbreak of mad cow disease occurred from the mid-1980s to the mid-1990s. By 2004, the United Kingdom had confirmed 179,000 cases of the disease, involving 35,181 farms. Over 11 million cattle were slaughtered and incinerated, causing economic losses of billions of pounds sterling. Scientists who autopsied diseased cows found that the cow's brain tissue had holes and was sponge-like. After conducting various studies and investigations, they ultimately determined that the root cause of the disease was that people wanted to improve the economic efficiency of pure vegetarian cows, making them more productive. To do this, they added the internal organs of dead cows and sheep to the cow's feed. These organs were likely from diseased cows and sheep. Healthy cows that ate the contaminated feed also contracted mad cow disease. Over the past 20 years, mad cow disease has spread to 31 countries in Europe, America, and Asia. People began to worry that mad cow disease could be transmitted to humans, and many countries became afraid of eating beef. Although many countries, including the United Kingdom, slaughtered and incinerated a large number of diseased cows, it still caused huge economic losses and social panic, and even evolved into a diplomatic crisis. The consequences of this man-made cannibalism are undoubtedly tragic. TSE in human society. In humans, there is also a typical TSE known as kuru. It is the earliest TSE disease discovered in humans, and it is limited to the 4 people of the eastern highlands of Papua New Guinea. They have a long-standing tradition of eating the organs of deceased relatives. However, this unethical tradition soon had terrible consequences. In the 1950s, these people began to exhibit a series of strange symptoms such as tremors, joint pain, slurred speech, and uncontrollable laughter. This is the TSE kuru in human society. The word kuru means trembling with fear in the local language. Initially, patients experience headaches and joint pain. After a few weeks, they may have difficulty walking, accompanied by tremors. In the later stages of kuru, patients may gradually develop dementia and amnesia, eventually leading to death. Kuru patients sometimes uncontrollably laugh for no reason, which is why the disease is also known as laughing death. However, this laughter also means that the patient is nearing death. Kuru has a long incubation period of 4 to 30 years, but the disease course is short. Most patients die within 3 to 9 months of onset. Scientists discovered that from 1957 to 1960, a total of 1,000 people died from the disease. The peak year was 1957, when 60% of cases occurred in women and children and only 2% in men. Later, scientist Michael Alpers discovered that in the local customs, it was primarily the male members of the tribe who chose and consumed specific parts of the body, usually the flesh, while women and children consumed the human brain. The invincible virus, the prion. So, after conducting tests, scientists brought a small piece of the brain obtained at the memorial service back to the laboratory for experiments on a chimpanzee. They observed that the chimpanzee injected with human brain tissue quickly exhibited symptoms similar to kuru disease. Through the final experimental results, it was discovered that the cause of kuru disease was a virus capable of invading the immune or nervous systems. This virus was ultimately identified as a protein molecule called prion. With the continuous efforts of generations of scientists, the mystery of the pathogenic substance of this disease has gradually been revealed. Scientists have found that this pathogenic substance, although it does not have a complete cell structure, is not a virus either, because it is a pathogenic factor formed by the abnormal folding of normal proteins. American biochemist Stanley Prisoner, after years of research, initially clarified some of the characteristics of prion. He found that soft prion are only 30 to 50 nanometers in size, and their structure cannot be seen under an electron microscope. Only after a special staining technique is used can the aggregated rod-shaped bodies be seen, which are about 10 to 250 by 100 to 200 nanometers in size. Through research, he also discovered that the avian virus exhibits remarkable resistance to various factors, demonstrating significant inactivation resistance. It shows considerable tolerance to physical factors such as UV irradiation, ionizing radiation, ultrasound, and temperatures ranging from 160 to 170 degrees Celsius. Additionally, it exhibits strong resistance to chemical and biochemical agents, including formaldehyde, hydroxylamine, and nucleases. Prion are also resistant to proteinase digestion, and they can cause slow viral infections without displaying immunogenicity. This is because prion only differ from normal proteins in their folding pattern, which allows them to evade the immune system's detection. Prion are truly a triple threat with ironclad, bulletproof, and invisible defenses. The pathogenic mechanism of the prion. The pathogenesis of prion is relatively simple. It is caused by the change of conformation of cellular prion protein (PRPC), which leads to the formation of pathogenic prion protein (PRPSC) in cells. These pathogenic prion proteins (PRPSC) aggregate and accumulate in central nervous system cells, eventually destroying nerve cells. In addition, according to the current understanding of prion by scientists, the consequences of prion infection are very serious. It is basically a life sentence for the prion to imprison the infected person. Once the disease breaks out, it can cause the patient's central nervous system to mutate and be incurable, eventually leading to death and madness. Prion diseases are caused by infectious proteins that can damage different parts of the brain. When prion infect the cerebellum, they can cause movement disorders, making it difficult for the infected person to control their body. When they infect the cerebral cortex, they can cause symptoms such as memory loss. The most worrying thing is that these diseases have a latent period which can vary in length. Some patients may develop symptoms within a few months, while others may carry the prion in their bodies for years or even their entire lives without ever developing symptoms. However, once a person is infected with a prion disease, they are contagious even if they have not yet developed symptoms. There is also a possibility that the disease can be passed down to the next generation through some unknown genetic mechanism. Meanwhile, some scientists believe that the future of prion is not optimistic. They argue that prion can constantly learn from different species and may evolve into a super prion that can break through the species barrier that scientists originally believed in and thus spread widely between other species and humans. Is there a way to prevent and treat prion diseases? Unfortunately, there is no effective treatment for prion diseases, so the only way to combat prion is through active prevention. Scientists have found that the only known cause of prion outbreaks is cannibalism. For humans, prion diseases can be transmitted in two ways: inherited transmission, such as familial prion transmission, and iatrogenic transmission, such as the use of pituitary growth hormone, corneal transplantation, and blood transfusion. To prevent the spread of the virus, the first step is to eliminate known sources of infection in livestock. Adequate isolation measures should be implemented for individuals already infected. Additionally, the consumption of contaminated food must be prohibited. To avoid iatrogenic transmission, strict protocols should be followed in surgical procedures, including thorough sterilization of surgical instruments. When it comes to corneal and meningeal transplants, donors with potential infection must be excluded. Lastly, for families affected by such communicable diseases, increased vigilance in daily life is essential to prevent their exposure to the virus. As human civilization continues to develop, people's moral and ideological levels have been continuously improved. Not only do people oppose cannibalism from a physiological and psychological perspective, but it has also been banned by many countries and written into laws and regulations. To end this slightly heavy topic from a different angle, human meat is not good to eat. Human muscle fibers are coarse, fat content is low, and the taste is bland. In addition, human meat contains a lot of hormones and antibiotics, which are harmful to human health. Therefore, if you don't want to eat bad meat and get sick, it is best not to eat your own kind. And that's a wrap for this episode of the video. I'm Dr. Red Panda. If any of you have your own perspectives, or if you think there are any errors in the video, feel free to leave a comment in the discussion section. If you found this video helpful, don't forget to subscribe and give it a thumbs up. Until next time, take care.